Okay.
Let me go this way.
Back there.
Okay.
Sorry about this. It just
All right.
Instagram went down at 128. So right before our interview. So perfect. All right. So yeah, let's just go live to tape then.
Okay.
What's up, everybody? Khaled Iwamura here from inbrampton.com, and I have the mayor of Brampton, Patrick Brown, on with me every Friday for the last 40 weeks. How you doing?
Good. Another week.
Yeah. So let's start with. So we just got a report that said Castlemore, the area of Castlemore in Brampton, has the highest COVID-19 positivity rate in Ontario now. What can Brampton, or what can you do about this?
Well, we know that some of the highest COVID spots in the province have been in Peel Region and in Brampton, and it's part of the nature of the work that we have in our region. And so, what we need is supports. We need vaccines. We need the resources to deal with the pandemic. And my heart goes out to these people that are facing a higher risk of COVID. We need to have their back. They've enabled the country to function during the last year. We need to have their back too.
So there's mumblings of a modified gray zone coming about hopefully today or even early next week. What do you think this will look like?
Well, frankly, I think we should be moving into red. You can't split up the GTA to have Oakville, Markham, Vaughan wide open, in Toronto and Mississauga and Brampton closed. It doesn't work. People move, they take their wallets to what is open. And so I know there's talk about a modified gray, but I just think we need to be more surgical. Where there's outbreaks in workplaces, deal with it strongly like we did with Amazon. But in terms of this never-ending lockdown on personal care services like hair salons and restaurants that doors have been shuttered for a long time. It's just not right.
What is the latest on the Amazon plant? Because I know that Amazon was appealing this. Is there any updates on that?
So I know they said they're going to appeal. I haven't been informed that they actually have appealed yet. So they've been closed.
Okay. Is Amazon, I asked this to Andrea Horvath as well, is Amazon an essential workplace or is an essential job provider?
So the province treats transportation logistics as an essential workplace. And so that's one of the reasons they've been given a very wide berth, a very wide exemption.
I know the Ford government most likely will not give the sick pay that you and the mayors have been asking for. If this is the case, is it time to possibly close warehouses for a small time being?
So I think the country has leaned overly heavily on Brampton and Peel Region and Toronto, these warehouses that are supporting the country's supply chain. It's not right for this burden to be placed on only a few cities for the whole country. You look at Amazon, 40% of Canada's shipments coming out of Brampton, but it's not just Amazon. There's all these different warehouses that we keep Canada together. And I would say, for me, it's not pointing the finger at the province. I don't care who fixes it, the prime minister or the premier. It's both their problems because either government could do it. We have the Canadian Recovery Sickness Benefit, and the feds seem to think that's adequate. It isn't. It takes 3 months to get back, and it's below minimum wage. And the province says, oh, there's a federal benefit, we don't need to do it. Well, the federal benefit doesn't work. 25% of our cases that we've contact traced in Peel since August have involved people going into work sick. 25%, then imagine, the community spread from that. And so, both the premier and the prime minister need to come together and understand it doesn't help pointing fingers at each other. Just find us a solution. Be collaborative.
With the new announcement of 700 new pharmacies, part of this vaccination pilot program starting, I believe, Monday, is Brampton part of this program?
So right now, we're part of the pilot program, but only for primary care providers. And so I would like us to be part of both pilots. I want us to be having AstraZeneca at pharmacies and at primary care providers. One city has been given both. That's Toronto. And so Toronto and Peel are in very similar circumstances with the spread of the virus. And so I believe Peel should be part of both pilot projects as well.
With the announcement of, I guess, the 75 plus that can register now for vaccines, what are your thoughts on that?
Well, we need more vaccines. It's just so slow. Here we are giving a few thousand vaccines a day in Peel. We have the capacity to do over 70,000 a day. And so we just need vaccines. We need to get more supply. That's the issue.
True. And I hate to sound like a broken record. Any updates on the new hospital in Brampton? I believe there's, what do you call it? The word slipped out of my mouth. The budget this month. So.
Well, the budget will be coming down on March 24th, and we will be actively looking at the budget and hopeful for good news. We've worked really hard over the last few years to convince the government that we need a new hospital. And I've got the Premier's word that he's going to come through for us. He made that commitment publicly, and I'm counting on him to come through.
Have you heard anything through the pipeline? You're saying it with a little bit of a smile, so maybe you know something.
Well, we'll just have to wait and see on March 24th.
Okay. The Ontario Hospital Association said that there's a third wave. What are your thoughts on that? And does Dr. Lowe think it's a third wave?
So I haven't heard Dr. Lowe describe it as a third wave, but we are seeing some increasing case counts that are driven by the variants.
Okay. And I know one of the questions I saw before Instagram went down, that there's some homebound older people that are over 80. Is Peel Public Health going out to possibly doing vaccines at people's houses?
So I have heard that they're going to look at ways to vaccinate those that are mobilely challenged. I know that there was one seniors home, Holland Christian Homes, where they've already gone to help with vaccinations, and they're going to look at ways to make sure that the most vulnerable in our community are vaccinated. Okay.
And last questions. I know retail's open because I've been out shopping at the small businesses. What small businesses have you checked out over the last week?
So first of all, let me say that this gray zone of having our small businesses open doesn't really, it's not adequate. They're barely allowed to be open. Only a few of them are allowed to be open because there's so many restrictions on the gray zone of what businesses can operate. And so, people are saying you should be happy you've moved from lockdown to gray, but for me, there's not much difference between gray and lockdown. I want to be in the red, where you can actually see businesses function, because for a lot of our businesses, there's not much point of being open under gray.
Sure. I know you talk a lot about red, but what does Dr. Lowe say about it? He's kind of the gatekeeper, right, so to speak.
Well, ultimately, he provides input to the provincial health table, he thinks that there's still concern over the number of variants, but last week he seemed more optimistic than he was this week. But it's difficult for me to describe what someone else's opinions are. It's only fair that you ask him directly.
Okay, I'll do that. And 15 degrees Saturday. Are you going to be jogging outside?
Hopefully I can get outdoors. We've now opened all the tennis courts, outdoor tennis courts in Brampton. So hopefully I'll get a tennis game in too. It is, because the snow melted so quickly, we adapted quickly. Normally we wouldn't have the tennis nets up that early, but we're trying to give people as many avenues to stay active and stay fit with the sports that are currently allowed. And right now the province is only allowing outdoor sports.
All right, Mayor Brown, thank you so much. Catch you next week.
Okay. Hopefully on Instagram.
Yeah, on Instagram. So,
Thank you.
Take care.